So welcome everybody. My name is Sarah Hess, working with the World Health Organization in Geneva. It's a pleasure to welcome you today to this EPI-WIN webinar. I'm delighted to have with me Alice Simniciano and Marta Lado, who will be presenting today on caring for persons with COVID-19 in the home setting. So I'm very delighted that Alice, who is an infection prevention and control specialist, and Marta, who is a case management specialist, both from WHO in Geneva, are here today to present and also to answer your questions. So if you do have any questions, please do put them in the Q&A function on Zoom, and we'll try to answer as many as we can at the end of the presentations. And as usual, we will be recording this, live streaming it to YouTube, so you can watch the recording there afterwards, and we will share a copy of the slides with everybody who has registered. So I'm going to hand to Alice. Thank you, Alice, for joining, and the floor is yours. I will share my screen for the presentation.
Thank you, Sarah, and thank you for the kind introduction. So as Sarah mentioned, my name is Alice Simniciano, and I'm here from the Infection Prevention and Control Group as part of the Health Emergencies Program to discuss how to safely care for a person with COVID-19 infection in the home. And I will be followed by my colleague from the clinical management team, Marta Lado. So I will let her introduce herself after my presentation. So just to go over the content that we will be presenting today. So first, I will just briefly show you the global situation that I'm sure you are all aware of. And then I will go into the infection prevention and control guidance on safely isolating someone with COVID-19 in the home, followed by Marta on clinical management in the home. And we will also have a slide on some additional WHO resources where you can find more information when interested. So if we can move on to the next slide. So as of today, there are over 176 million cases of COVID-19 reported to WHO and over 3.8 million deaths. And so this graph shows us by the WHO regions, the trajectory over time, as well as the deaths can be seen in the black line. I won't go through this thoroughly because that's not what we're here to discuss today, but just so that you have an overview. Next slide. So what can we all do to prepare in case someone gets sick in the household is to prepare a list of contacts, such as your medical contacts like your doctor, healthcare facility, and emergency numbers, and have these numbers readily available, as well as having a support network. This may be your family, your friends, contacts from school or work colleagues, and having a list of trusted individuals that you can reach out to in case you do need something, whether you are alone in the home or caring for someone at home and you may need some backup. As well, you can prepare by gathering some of the items that you will need in case there is someone who will get sick. These are things like masks and disinfectants, preparing a safe room for isolation in case someone does get sick. And if a room is not available, then an isolated space away from others, ensuring that there's adequate ventilation, which we will speak about later. And as we mentioned, putting a support network in place that may be able to help deliver groceries or may be able to help for transport or childcare or any other essentials. So what to do when a person does get sick in the household? Well, the first decision is really to understand whether this person can be cared for in the home safely. And this decision is really should really be done by a healthcare provider to determine if the person is appropriate for care at home. So if the confirmed COVID-19 person is seen by a healthcare provider and inpatient care in a health facility is either not available or the healthcare provider deems that they are safe to be managed at home, whether they have mild, asymptomatic, or a mild case, and that therefore they can be cared for in the home if done so safely. And this decision whether to isolate and care for them in the home depends on this clinical evaluation, which would entail that the person is not at high risk for severe disease. So they are not 60 and over, and they do not have any underlying comorbidities, which we've mentioned previously and are found on many of our websites. But just to review some of them again, the comorbidities are obesity, non-communicable diseases such as cardiovascular disease, diabetes, chronic lung disease, kidney disease, immunosuppression, cancer, and others. So if a person with COVID-19 infection does not have these comorbidities and is not over the age of 60. And as I mentioned, patients who are asymptomatic or those with very mild or moderate disease may be suitable for home isolation. Next, there should be an evaluation of the home setting to suitably isolate them. This means having a dedicated isolation space, whether this is an individual room or a space away from others, and having access to the necessary supplies. And finally, third, the ability for someone in the home to monitor the evolution of this person with COVID-19 and ensure that if they do advance and need healthcare monitoring in a healthcare facility, that they can be safely transferred to one. The second part is that in a home setting, you should select one caregiver that can care for the person with COVID-19 infection. This person must not be part of a high-risk group themselves. As I mentioned, those who are 60 or over or with any underlying comorbidities. And the healthcare provider should ensure that there is instructions and training given to this caregiver on how to safely care for the person as to minimize transmission of infection to others in the household as well as to themselves, and to train them on the signs to look out for, signs that the person's condition could be worsening and that they would need to be transferred to a healthcare facility. So next slide. So speaking of infection prevention and control measures, these are the measures to prevent infection to others in the household. First, as we mentioned, the person needs to be isolated, and I will go over this in the next slide in more detail. We always recommend the same protective measures of maintaining at least 1 meter distance from the person with infection, opening windows to ensure fresh air and ventilation is occurring, designated the one caregiver in the household, and limit the contact with this person to the caregiver, as well as ensuring hand hygiene is done frequently, especially before and after infection with the person who is isolated, wearing a medical mask, and having the person with infection also wear a medical mask when they are in the presence of the caregiver or others, using designated cutlery, towels, and bed linen for the isolated person, cleaning and disinfecting the high-touch areas in the house and the room of the isolated person frequently, and disposing of the patient's waste safely in a closed bin. And finally, not allowing any external visitors into the home when there is an isolated person, as to minimize transmission to others. Next slide. So how to safely isolate someone in the home? Usually we recommend, as in healthcare facilities, to prepare a separate room or isolated space away from others. If a separate room is not available, at least if they are able to remain in a separate bed or a separate space from others, and maintaining that distance that we mentioned before, and keeping the movements of the person who is infected limited within that room and not to go throughout the house and touch things. Keeping the room well ventilated and opening windows frequently, designating dedicated cutlery, towels, and bed linens like we mentioned, and laundering these frequently, and containing any waste generated from the person in isolation in an enclosed bin and disposed of safely, as well as cleaning and disinfecting their area and high-touch surfaces daily. And I know this may get a bit repetitive, but these are really the protective measures that we recommend for everyone, and more so for those in isolation with infection. Next slide. So speaking of ventilation, this has been quite the hot topic for us during this time, and we need to ensure that, especially when persons are isolated within a home, that those in the household are making maybe more of an effort to have adequate ventilation in the room. So what this means is that you can open windows, and although many of us cannot measure this rate, the ideal and minimum recommended rate is 10 liters per second per person. So for those in work buildings or in other public areas, this air exchange, and in healthcare facilities, of course, this air exchange is monitored and is increased based on needs. But in the home, you can do so naturally by opening windows. There are other buildings that may do so mechanically. And so they have mechanical ventilators, what we refer to as either air conditioning or HVAC systems. And usually if people do have access to those in their homes or other buildings, they should be really regularly inspected and maintained and cleaned, and make sure that they are functioning properly. And just to mention, as we often did in healthcare facilities, the use of fans for air circulation should really be avoided, especially when there is an infected person in the house, because what fans do is they take the air from behind them and they circulate it forcefully into the rest of the room. And so in a healthcare facility, we really advised against this, because any droplets or anything coming out of a person's mouth or nose would be forcefully projected into the environment, which is exactly the opposite of what we are trying to do. We are really trying to contain the droplets of the sick person to themselves and not to others. And so we can move on to the next slide. And so for the person who is isolated and infected, the recommendations for them really are the same: to isolate yourself, stay in the room and isolation space as much as possible. Try to limit going out in the home and having contact with others, especially trying to limit physical contact with others in the household, although they may be your partner or your family or your kids. Really trying to avoid contact and avoid close contact with them. I know this may be hard in some households, but trying as much as possible, as we do know most of the COVID-19 transmission has occurred in households and to other members. And so when you are required to leave the room, let's say to the bathroom or to eat or to do other activities, to maintain distance from others as much as possible. Make sure you clean your own hands when leaving your room and your isolation space, so you're not bringing anything with you and touching all over the home to spread any particles that may be on your hands, and to wear a medical mask when around others in the household, and especially when around the caregiver who may be in closer contact with you. Next slide. And so for the caregiver, so this is that one person that we are dedicating to ensure that they are caring for the person with infection. How to prevent infecting yourself and others in the home. Really the same measures that we've said over and over again. So ensuring that hand hygiene is done before and after caring for the person with infection and their surroundings, before and after preparing food and eating, after using the toilet, and whenever hands look visibly dirty or visibly soiled. You can use either alcohol-based hand rub, or in a home, hopefully, water and soap is more readily available, and so that can be used as well. Wearing a medical mask when around the person with the infection, and having them wear a medical mask as well. So this is why we mentioned to really stock up on those supplies as soon as, either ahead of time or as soon as you know that you may have someone in the household who is infected. And to avoid, as much as possible, contact with the person's secretions. So they're coughing or sneezing or anything else that is coming out of their mouth, to really try to avoid and limit as much as possible contact with those. And collect any waste from the person with infection in an enclosed bin and dispose of safely, and cleaning their areas regularly. Usually we say daily if possible. Next slide. And my favorite topic in IPC, speaking about masks, I think could speak about masks in our sleep at this point. We've talked about them for the past year and a bit. So how to wear a mask safely. And I know most of you know this, but let's go through it again, especially for the caregiver and especially for the person with the infection when they are around others, to, before you even think about putting on your mask and touching your mask from wherever it is, to clean your hands. So cleaning the hands with soap and water, as I mentioned, or an alcohol-based hand rub. This ensures that you're not contaminating the mask that you're about to put on your face with anything that you may have picked up from the environment or with your own secretions that you get on your hands when you cough or sneeze or touch your face. So we've cleaned our hands, and then going to put on your mask by covering your nose, mouth, and chin. So this is really important because even a year and a half into this, we still see people with a mask under their nose. And although this is still covering your mouth, it's not covering the mouth and nose, which droplets may come out of. So it's really important you get both of those under the mask. And so to wear the mask throughout the patient care activities, as we mentioned for the caregiver, is very important. So putting the mask on before you go to see the isolated person, doing your activities, and then when you're ready to take off the mask, you clean your hands again to make sure that you're not touching your face with any of the contamination that you may have picked up from the environment. And so taking off the mask by the straps and then cleaning your hands again once you've discarded or put away the mask. Next slide. Thank you. So hopefully the home care for the person with infection and in isolation has gone smoothly and they are still maintained at home. So when to discontinue this home isolation? Well, for symptomatic patients, so those are patients who have had symptoms, we say a minimum of 13 days. So that means 10 days you count from your first symptoms. So from the first day that you've experienced any COVID-related symptoms. And then we want 3 days of no symptoms at all. So whether that's 13 days at minimum, or if after 10 days you find you still have some symptoms, you would start your count of 3 days later. Whenever you no longer have symptoms, then you count 3 days, and that's when you would discontinue. So it's a minimum of 13 days or longer if you're still experiencing symptoms. And we know there's discussions about people having long-term COVID symptoms. So those would have to be discussed with your healthcare provider if it goes beyond this time. For those who are asymptomatic and have never had symptoms, but have tested positive, it would be just 10 days from the positive test. Now, this may vary within from your medical provider. They may provide other types of guidance or your local public health guidance. And so it is really a caveat to follow that primarily. And first of all, be aware of that guidance and listen to your medical provider. These are just general guidance that we've set out based on the evidence that we've reviewed on how long the virus actually sheds for. So minimum of 13 days or longer if you're still experiencing symptoms. Next slide. And just to mention, for those of you who may be a little bit more interested and you would like more information, there is a whole technical guidance document that was compiled by the Infection Prevention and Control team in collaboration with the clinical management team. And it was intended to guide public health professionals, IPC professionals, healthcare facility managers or workers, and community-based health providers in addressing all of these issues that we've mentioned today and giving instructions on how to safely care for patients with COVID-19 at home. Just to reiterate again, very critical that caregivers who are not healthcare providers also have the appropriate training and guidance on how to care for these people at home. And to minimize the risk of infection to themselves and others, they need appropriate training and supplies to do so. And that's the end of my slides. I think there was one more slide, and I just wanted to remind you all of the measures once again. Keeping your distance from others, we say at minimum 1 meter, but preferably more. Ensuring your hands are cleaned frequently, and especially when using the masks, as I've mentioned. Practicing respiratory hygiene by coughing or sneezing into your elbow or tissue, ventilating rooms and enclosed spaces, wearing your mask when around other people. And now we have the vaccine to add to this as well, and getting your vaccine when it is your turn and when available to you. So thank you so much for listening to my portion of these slides. I'll pass over now to Marta for her portion on clinical management. Thank you.
Yeah, thank you, Alice. Thank you, everyone. I'm seeing the chat going very vibrant, which is good, like a lot of questions and a lot of interest in the home care management for patients with COVID-19 infection. So let's just start with the area that is dedicated for the clinical management. What do we have to do in terms of medications, in terms of a management of symptoms? So next. One of the important points that we really want to make clear when we talk about like after a diagnosis of COVID-19 infection is that should be done in some kind of health facility, laboratory, and should be consulted with one healthcare provider, as Alice was saying. This graphic looks a little bit confusing, but what I was trying to make sure is once you have been diagnosed and the test is positive, it's important to make a differentiation between what kind of symptoms do you present. Are you a patient that don't have any symptom? Or do you have maybe some kind of mild symptoms that doesn't produce like a big severity in your condition? Or you have like problems of breathing, need of extra support like oxygen or other devices? So then you will need to be managed in a healthcare facility. This differentiation is important because although we know that many healthcare systems have been collapsing during this pandemic, we still need to acknowledge that patients that need extra support like oxygen or organ support like ICU need to be referred to a healthcare facility and should not be kept at home, because that care will not be possible to be done in a home basis. Next. So the figures that we now, after 1.5 years, we are aware is that the majority of the patients are going to present mild disease or what we consider moderate disease. Only between 15–20% can have some kind of complications or severe condition that would imply that they need to go to a healthcare facility to get further support. So when we talk about 80% of the people is the big majority, and these are people that can definitely be treated at home, like people with COVID-19 infection positive, but they don't need like extra management. So then they can be managed at home following the precautions that Alice was presenting before. And this is the differentiation that is extremely important that all the population and the healthcare providers understand, that what do we consider non-severe, what we consider severe and critical. So a patient or a person with COVID-19 infection that we consider non-severe is because they don't have any sign of severe or critical disease. Severe is when you already have like a saturation of oxygen. So then the amount of oxygen that is in your blood is dropping, is going down, and mainly when it goes below 90%. And that's why we have these machines, the pulse oximeters that we normally use to check in our finger what is the percentage of oxygen that we have in our organism. And that helps us to categorize you as a severe or non-severe patient. Also, if you start breathing really fast, like the respiratory rate is very high in adults or children, or you're having some kind of respiratory distress, like signs that are showing that you have like a big difficulty. And then the critical are the ones that definitely they will need some kind of life support. They need to be in an ICU with some like further or critical management. Next one. No. So we are going to center ourselves right now in the cases that we consider non-severe. And the non-severe cases is what you will probably hear many times as mild disease or moderate disease. So what is that? Like when we consider mild disease, when one patient has some symptoms, they meet the case definition, like normally it's like fever and some kind of epidemiological link, but there is no sign or no evidence of pneumonia or low oxygen, what we normally call hypoxia. And this is why after the diagnosis of the infection for COVID, it's so important to have like an assessment by a healthcare provider that will be able to assess the presence of signs or symptoms related to pneumonia or hypoxia or low oxygen. Moderate disease is patients that they have infection for COVID-19 and they have probably signs of pneumonia, like you could see like an X-ray maybe that is done, or a CT scan, or even like a cough and fever that could suggest that this patient is having probably a pneumonia, but the amount of oxygen that is in the blood that can be quantified by the pulse oximeter is more than 90%. In those cases, is what we call a moderate case. So normally, unless they have a risk factor that we will talk about that later, these patients normally can be managed at home, but they need to be monitored probably more closely. They need to have probably like a daily call with a healthcare provider, that you can be reporting them if there's any change in the symptoms or any change in the clinical condition. So then they can assess in a daily basis if you need to be referred to a health facility because you are worsening, or you're stable and you can still be at home. So when we talk about pneumonia, normally, how do you know if you have pneumonia if you cannot do an X-ray? For example, in many settings, we know that it's not accessible or it's not available in a direct way. So normally we consider that could be someone who has fever, cough, difficulty breathing, and normally we consider normal pneumonia when the saturation, the oxygen in the blood, as I said before, is always the same or more than 90%. If this goes below that is when we start considering that could be a severe pneumonia. And as I said before, severe pneumonia in these cases, normally we recommend that you should be taken to a healthcare facility. But that's why this is so important. After a diagnosis with a test positive for COVID-19, you should be assessed by a healthcare provider to be able to categorize you in these different stages of severity of disease. Next one. So we have been repeating risk factors, these factors. The risk factors, apart from the age, that we all know that persons with COVID-19 infection that are older than 60 years, normally we consider them that they have more probability of developing complications like severe pneumonia or other critical conditions. So normally, apart from the age, there are other conditions that could make you more susceptible to develop more complications. And those ones are the overweight or obesity, non-communicable diseases like hypertension, diabetes, chronic cardiac disease, chronic lung disease, cerebrovascular disease, dementia or mental health disorders, chronic kidney disease, and some stages of immunosuppression, including HIV. Also, like HIV patients can have like a higher risk of developing complications, patients that are going through cancer, and also smokers. In pregnancy, mothers that are, or women who are pregnant and have increased maternal age, like are older, or also overweight with a high BMI, non-white ethnicity, and also pre-existing comorbidities, as I said before, like hypertension, diabetes, cardiac, lung, kidney disease, etc. And also pregnancy complications, like, for example, women who are diagnosed of gestational diabetes when they are pregnant, or also preeclampsia, like problems with hypertension during the pregnancy. Those are specific populations that have a higher risk of develop complications. It doesn't happen 100% of the times, but these are the patients that we normally try to monitor more closely, because we know that there are higher population with these risk factors that have developed complications of severe or critical disease. Next one. So normally, if the patient is asymptomatic or mild disease, they stay at home. I will explain a little bit more about what kind of monitoring we normally recommend to do. But normally in asymptomatic and mild, it's just like an initial assessment by the healthcare provider. And normally they go well and they don't need more close monitoring. But patients that are in a moderate condition, so they probably have pneumonia, or you suspect that they can have pneumonia, but the oxygen is still not going down and they don't need like extra support like oxygen or ICU treatment, they can stay at home. And what we normally are recommending is that they should be followed by a healthcare provider, and be given like a pulse oximeter, like this machine that you are seeing in the picture, and they can monitor the saturation at home, because this is what is going to make a big difference of you can stay home or you should go to a healthcare facility. So normally we recommend the patients to use the pulse oximeter and report to this healthcare provider in a daily basis, or at least twice a day, about like how the saturation is going. Because if the saturation, the amount of oxygen that they have in their blood is less than 90%, then these patients should be referred to a healthcare facility, because they are going to need oxygen, probably. Yeah. And also, but if it's in between 90 and 94, we always recommend to do like a close monitoring. And if the trend is that they go from, for example, 98% the first day, and progressively you are seeing that it's going like 95, 94, 93. So then the trend is going down. In those cases, also, we recommend that maybe you should be assessed in a hospital and check and decide if you need some oxygen. We don't recommend the use of oxygen devices like oxygen cylinders, oxygen concentrators at home, and mainly because they need a specific maintenance, they need a specific instructions to be followed, and they can be even dangerous if they are not used properly, and also they can cause even more damage than help. So the use of oxygen at home without a health provider following it up closely is not recommended currently. When the saturation goes below 90%, or the trend is going down, so then you're going to be sent home to the healthcare facility to be given oxygen, is when normally we are recommending as WHO to be prescribed steroids. There are a lot of right now recommendations about using steroids in a non-specific way, and in patients that don't need them. And steroids can also have like some kind of side effects, and mainly in patients that are diabetic or they have uncontrolled sugar. So we recommend that the use of a steroid should be always prescribed by a healthcare provider. They should preferably not be given at home unless a health provider is going to be monitoring them, and normally corresponds only in the populations that are severe or critical. In mild and moderate disease, steroids are not recommended to be used in patients because they don't improve the survival, they don't improve the outcome, and they can produce more side effects and complications than doing nothing. Okay, next one. So in patients that are going to be mild and they are going to stay at home, normally what we recommend is just like having like an initial checkup when the symptoms started. So then the healthcare provider can tell them like, yes, you can be at home, it's okay, no problem, and no more follow-up unless there is a complication or an addition of symptoms is recommended. In moderate cases with no risk factors, we can suggest the home care, but we need to make sure that one healthcare provider is in contact with the patient or the caregiver. So then we take the saturation, as I said before, at least twice a day. And if the patient has hypertension, also the blood pressure, and we control the neurological status if the patient is conscious, if he's oriented, if he's confused, etc. And also making sure that the heart rate also is controlled and the patient is not having like palpitations or heart rate. Next one. There were some questions coming into the chat before and even before this webinar that is like, what do we do if we don't have houses that are adapted to be? So in some countries where the isolation of one patient at home is extremely difficult because there is no separate room where you can have one patient with at least one window and you can separate the patient from the relatives or the rest of the householders. In some countries, they have started making some initiatives about community care facilities that normally can be suitable to be used for patients that have mild, moderate, without risk factors, and they can be distributed in a surface, and mainly when they are confirmed, they can be sharing the same space, and they should be monitored by healthcare providers at least one nurse, one community health worker, or even a doctor, and they can monitor the vitals during the different shifts of the day. And if they develop any complication, they go to a healthcare facility. If they are monitored and they are doing well after the time that Alice was mentioning, like at least 13 or 2 weeks period where we know that the patient normally tends not to be infectious anymore, can go back to their home. And then you can prevent the infection with the rest of the people who are living in the house. So normally in some countries, what they have been doing is using maybe stadiums, gymnasiums, hotels, or even tents that need to be quite well ventilated. The healthcare providers that are working there should be always using the PPE, like the personal protective equipment, just to make sure that they are protected, and also make sure that we don't mix people who are suspected cases with confirmed. We need to make sure that that differentiation between, to avoid cross-infection, is happening. So we have like quite updated guidelines and recommendations or guidance in our website of WHO. You could find like the home care for patients with suspected or confirmed COVID-19 and management of their contacts. And this is also including not only the home care, but also the community centers that have been a very innovative initiative that has been happening in many different settings. Next one. So we wanted to reiterate the idea that currently, right now, mild and moderate COVID-19 infected people should not be treated with any kind of medication, because there is no evidence so far that any of these medications that we have been collecting information, collecting evidence, and many scientific and research groups have been studying what is the efficacy of them, like ivermectin or hydroxychloroquine or lopinavir, ritonavir or remdesivir. Those medications have not shown efficacy in reducing mortality or changing the outcome of patients, neither in non-severe or severe or critical cases. So WHO currently, the recommendation is not recommended their use in any of the stages of severity. Steroids currently have shown efficacy in patients that are severe or critical, but not in mild or moderate. They can produce more side effects and more complications if they are taken at home without the supervision of a health provider. And also in mild and moderate cases, they have not shown any reduction in complications or any reduction in progression to ICU or mortality. So the recommendation for the home care is patients should be given a lot of fluids, like a very good hydration, nutrition, paracetamol, if it's needed because of fever, body pain, or other discomforts. Antibiotics have shown no efficacy in COVID-19 and could only be prescribed if one specific bacterial infection has been suspected or confirmed. But antibiotics don't work against COVID-19, so they should not be recommended or given at home or in the hospital. And also encourage the patient to take rest, but always taking in account that he should be able to go back to their normal activity at their pace, but as soon as possible. Try not to reduce the activity too much while is in these 2 weeks at home doing the isolation. So as I said before, no specific therapy has been approved and recommended against mild or moderate COVID-19 as treatment or as prophylaxis. Next one. And when to refer these patients to the hospital. As we were saying before, non-severe cases can remain at home. If they don't present any complications, they can stay at home. So the patients that will be, or the people with COVID-19 infection that should be referred to be admitted in the hospital will be the severe and critical cases, the moderate cases with the risk factors that we were have mentioned before, and then mild or moderate cases that while being at home start worsening and developing new symptoms, and mainly when they start complaining about chest pain or difficulty breathing, confusion or altered mental status, or loss of speech or mobility. Those patients are the ones that's why the healthcare providers should be monitoring these moderate cases at home. And as soon as they see any kind of change is when they should be referred to the hospital to be able to be given oxygen in all the different forms that we have available. Next one. So there are many resources that you will find in our website. So as these slides are going to be shared, I think it could be good for all of you if you want to get more deep knowledge or some specific questions. You can go to these following links in our website. And I think for now, I'm going to leave it there so then we can have some time for the questions and answers. Thank you very much.
Wonderful, thank you, Marta. And yes, as you just mentioned, we will definitely be sharing the slide set with everybody that has registered. So we've had a lot of questions that have come in. We'll try and run through as many as we can in the remaining 15 minutes. Alice, there's been a lot of questions about mask use. So both in the chat, I know you did answer them, but for those who are also watching after the event, it'll be home care setting, you have the patient, you have the carer, and you have the other family members in the household. Which masks should those three groups wear and when?
Great, thank you. I have been trying my hardest to answer them in the Q&As, but I realize I should have had a more specific detailed slide on this, so apologies. So for persons with confirmed COVID infection and anyone caring for them, so usually in the healthcare facility, we give this guidance to health workers, but in this circumstance, those caregivers in the home are technically the health workers caring for someone who is infected. So both of these people should wear medical masks. So medical or surgical masks, these are interchangeable. These are the masks that you would find in stores or in healthcare settings, or that can be provided to you by a healthcare professional. These are standardized against international standards. They are all made from material that has been tested for breathability, for fit, for filtration, and they are shown to protect the wearer and the persons around them from droplets. And so that's why for persons that we know have confirmed infection, we do recommend medical masks. And have confirmed infection, we do recommend medical masks. And for those caregivers for them. And so for those rest of the people in the household, they do not need to wear a mask unless they come into contact and close contact with the person who has this infection. And so unless they are going into their room or coming into contact with them in other scenarios inside the home, they should then also wear a medical mask when available. The fabric and cloth mask we usually recommend for people who are out in the community where we do not know that there are confirmed cases or that they are not themselves sick with COVID-19 infection. And so that unfortunately, the fabric masks, we cannot determine how protective they are. We do know they offer some sort of protection, but as you've seen, they vary very much from the type of materials and the fits that they have, especially the ones you can buy in store or the ones people are making at home, or as people have mentioned in the chat, the makeshift ones out of scarves or other materials. We can't guarantee the filtration of those. And so that's why for people we know have confirmed infection, it is always the medical masks. So I hope that answers many of the questions around the masks.
Thanks very much, Alice. And while we're on the subject of masks, there were a couple of questions about double masking. Is this something that WHO recommends? And if so, is it recommended in the home care setting?
Thank you. Yes, also very important to note, as we have seen it a lot in the media, especially as of late, WHO has assessed this issue, and we do not recommend double masking per se. We do, however, recommend masks that are well fitted and that are standardized against these international standards that have been laid out and are getting updated as we speak, there are large groups of people at WHO and out in other organizations working on developing standards even for fabric masks. And so we do not recommend double masking. We do recommend finding one mask that is appropriate to your face, that fits well, and that shows to be effective and has the correct fit, filtration, and breathability, as we've mentioned. And so these are things that you should look for when you buy a mask in a store and it has the packet where you can read about it. You should see if it is something that has been approved and standardized. If it does mention about the filtration, the efficiency, all of this information is also available on the WHO websites. And there's also a specific guide, actually many guides on mask technical specifications that you should be looking for.
Thanks very much, Alice. So Marta, we're going to move to you. A question that's come through. Evidence is emerging that patients who are infected with COVID-19 after having a vaccine are presenting a different range of clinical features. Is this something you can comment on?
I think it's quite early for all of us to give clear statements about the rate of reinfections after vaccination, and also what is the spectrum of symptoms that these patients may present. But what we know so far is that vaccination prevents the infection, but it's mainly prevention of severe and critical disease. So even after vaccination, there is a small percentage of probability that you can still get infection. Normally, in most of the vaccines, goes from 15% to less than 5%. So it's a very small probability, but it's still existent. There is no protection of 100% with any vaccine from infection. But what we do know is that all of the vaccines, at least the ones that have been reviewed and approved, are protecting people from developing severe and critical disease. So even if you belong to this 5% of patients that after vaccination contract the infection, the probability of developing a severe disease that will need oxygen or ICU care is extremely low. So this is what we are trying all to work through the vaccination. No, like we know it's not going to prevent 100% of infections or second infections, but at least is going to prevent people from having to be admitted and needing a critical care because of severity or critical condition. So we still need more evidence. We still more data. Time is going. This is a new disease, our new vaccine. So we still need to be very observant and seeing how the situation is ongoing. But so far, the data that we have is that definitely the progression to severe and critical disease because of the vaccination is very, very evident and has decreased the admissions of, in many countries that have like a very big coverage of vaccination, the rate of admission in the hospital or ICUs is definitely decreasing.
Thank you very much, Marta. We'll stay with you. There have been a couple of questions about specific settings where the healthcare system is overwhelmed. You're caring for patients at home. They begin to show signs of severe disease, but may not be able to access a healthcare facility. Is there any specific guidance or strategies for caring for these patients that are worsening, but waiting to access a healthcare facility?
Yes, what we know is that the best care for severe and critical cases is healthcare facilities where they can have specialists and they can have specific interventions like oxygen, fluids, and other maneuvers to control the severe or critical symptoms. So the recommendation is whenever possible, the severe and critical cases should be referred to a facility where they can be given what they need. We all know that the system is getting overwhelmed in many places, and with the new waves, with a lot of patients coming in a quite difficult situation. So we are not blind, and we know that many people in some settings will have to be retained at home because there is no vacancies in healthcare facilities. But the recommendation is that the use of oxygen and other medications at home could be even more dangerous than beneficial. So they should always be prescribed by a healthcare provider, by a clinician. Second, need to be monitored by some clinician or healthcare provider. And third, they need to be having some kind of monitoring in a daily basis to check how the patient is progressing in case that there are more interventions that needed to be implemented. So currently, right now, there is a recommendation for these severe and critical cases to be given steroids. Dexamethasone normally is the one that has been more recommended, 6 milligrams a day, around 10, 12 days, but it's only recommended for patients that are in severe or critical condition. The use and effectiveness in mild or moderate disease is not is showing that they don't help to reduce the complications, they don't reduce the mortality, they are not beneficial, and they can produce even more damage. So the recommendation is in severe and critical cases with COVID infection should be managed by healthcare workers in a healthcare facility. And if that is not possible and should be done at home, they always should have like a very direct supervision, and mainly they are going to be taking steroids or oxygen.
Thanks very much, Marta. So Alice, back to you. There have been a couple of questions about face shields. Are these recommended? Do they provide extra protection?
Thank you. Yes. So face shields are seen as an alternative to goggles. So usually when in the hospital, we recommend health workers to wear PPE, so personal protective equipment, and that means the medical mask, the eye protection, so either goggles or a face shield. So the face shield is in addition to the mask. It covers from your forehead, covers your entire mouth, and goes to the bottom of your chin. So it offers eye protection. It does not offer the same protection as a mask does because it is open underneath and air and droplets can still get under and around the face shield. And so they are definitely beneficial. They are just a bit harder to come across, especially in our community settings. And in a lot of countries, they have not been made available. And so usually we recommend them as an eye protection for health workers. Of course, when you're caring for someone in the home, it would be most ideal to have the full protective equipment to ensure that you're not getting infected, but we know that this is not a possibility for many. So the mask is really your main source of protection when you're caring for someone in the home. If you have a face shield, great. It would also protect your eyes, which are also a mucous membrane. So the mask would go up to here and your face shield would go on top. I hope that answers the question.
Great, thanks, Alice. Just to go back, Marta, to you and the question that we had about monitoring severe patients at home as they wait for access to care facilities. There were a couple of comments and questions in the chat about prone positioning of patients. Is this helpful as well? So maybe you'd like to respond to that too.
That is a very good point. So what we know even before COVID is that the proning awake position, which is like moving the patient, positioning them, being awake, in severe respiratory infections is something that has been quite useful and has been used for patients with acute respiratory distress or some kind of respiratory conditions when they are admitted in the hospital. And it helps to ventilate the lower and mainly the back sides of the lungs and have been very beneficial to improve the ventilation of the lungs of people who are having severe acute respiratory infections. No, so the proning thing is not a new thing. So with COVID, definitely what we have seen is that in some patients, as long as the patient is awake, is conscious, can collaborate, because the thing is that the patient needs to be making the movements, and it's a very uncomfortable situation. Some patients are nauseous, some patients are maybe feeling like abdominal pain or feeling dizzy or whatever. So you need to consider all these factors to be able to implement the proning, which is like the changing of the position for the patient to help them to clean the lungs a little bit and help the ventilation of different parts of the lung that normally don't ventilate so well when they are just like a lay down. So definitely what we know and we have seen evidence is that in patients that are having moderate and severe disease, the awake proning has been beneficial on them as long as I said before, they meet this criteria. You know, they are awake, they collaborate, they feel comfortable, and they are able to move themselves without any help, because it's a condition that not all the patients are able to tolerate for longer period of times. You know? So we definitely have seen that the recommendation of doing proning in patients when they are starting to have respiratory distress or when they already have like pneumonia or severe pneumonia could be beneficial, but you need to be careful that the patient tolerates it. If the patient is not able to maintain different positions during the day and move in an autonomous way, is a procedure that can be even more detrimental. So you need to always count with the collaboration of the patient. But yes, it has shown evidence in many patients when they are having respiratory complications.
Thanks very much, Marta. I know we're just 1 minute before time and there's still so many questions that have come through that unfortunately we won't be able to answer, but I know that you've both been monitoring the chat and the Q&A. So just before we end, I'm going to give Alice and Marta a couple of moments to make a final comment or to address one of the last questions that they thought was really important. So Alice, do you want to start?
Sure, thank you. So I think for me, I just wanted to reiterate again the points and the measures that we really do prioritize, not just for home care, but throughout the COVID pandemic and for everyone. And that is especially to say that when we know someone is sick, we need to enforce these even more so and more strictly and more correctly. We need to enforce the same principles that we have been recommending and we have been trying to enforce since the beginning. So that is keeping your distance from others, especially those who are sick and symptomatic. For those who are sick themselves, they should be wearing a medical mask to prevent transmission to others, whether they are in the home care isolation or in a healthcare facility isolation, or they do not know they're sick yet, but they feel they have symptoms and they are out and around others. They should try to isolate themselves as soon as possible and try to determine if they are positive for COVID-19, to stay home in isolation and contact their medical providers. The point that we have reached now is that we are trying to suppress transmission as much as possible. And so the measures that I mentioned and the measures that the field of infection prevention and control is responsible for are these ones: to maintain your distance, to clean your hands, to wear a mask when appropriate, to ensure that ventilation is adequate in enclosed rooms, settings, or buildings that you are in. And for yourself, if you do have any symptoms, to cover your coughs, your sneezes, and ensure that you are not going out and about around others if you do notice you have any respiratory symptoms. So I'll stop there and stop reiterating the same messages, but those are really the ones that I want everyone to remember today. Thank you so much for having me, Sarah.
Thank you, Alice, and thanks for answering all the questions so clearly. Marta, over to you if there's any final points or questions you'd like to address before we close.
Yeah, I think that I've seen in the chat, in the Q&A chat, some questions related to the use and the effectiveness of different medications and how to prevent the progression from mild disease to severe, and if there's anything that we can do, but also what is information that we need to give to the general population, because this has created like a lot of uncertainties about like what is efficient, what is not, what is a good medication. So what we have learned so far in this year and a half is that patients who have risk factors, even if they don't have many symptoms, they need to be monitored well at home. Patients that are old age, non-communicable diseases like hypertension, diabetes, heart disease, lung disease, kidney disease, cerebrovascular disease, immunosuppression, etc. These patients need to be monitored by a healthcare provider at home. That could be a nurse, could be a doctor, could be a community health officer, but it's extremely important that somebody monitors them And the pulse oximeter is something that we have seen in the moderate cases that can prevent much more than any medication that you give at home in terms of progression. If you start seeing that the oxygen is going down in these cases, is when you need to recommend them to go to the health facility to get oxygen. If we start getting the oxygen and the steroids when the respiratory complications are starting, is when we definitely can change the outcome of the disease, and we can reduce the number of patients that go from severe to critical. But no drug has shown that efficacy and that effect. And this is one of the things that we are fighting for extremely hard right now, because there's a very big community engagement about like taking medications to prevent, and we are seeing a lot of damage and a lot of side effects and adverse effects because of taking medications in an erratic way, no? And it's true that there's a lot of uncertainty about COVID, and is a disease that we have been learning progressively in the last year. But now we have quite a lot of evidence that supports the idea that giving these medications as prophylaxis or treatment at home are not helping the patients, and they are producing even more problems. So it's more about monitoring them at home, on community centers, and as soon as they start with needs of oxygen, that you see that the saturation of oxygen with the pulse oximeter is going down, then is when you have to look for spaces where you can give them oxygen and close a care from healthcare providers. But is it really important that we create a sensitization about the disease? Because it's true that the toxicity for many medications that have been misused and misdosed have created even more problems. And right now we have like quite clear evidence, and we still have a lot of things to learn. So it's important that you trust your health providers, and the health providers keeping updated about like what are the last evidence that is coming out. So thank you. I hope that it was useful for everyone. We are always happy to collaborate in these initiatives, because we all think that what we need to be is like all together and create more sensitization about what is available right now. So thank you very much, Sarah and team, for the invitation. This is a very good initiative. Thank you.
No, thank you, Marta and Alice, for coming on and presenting and answering the questions. And thank you to everybody for joining and contributing questions to the webinar. So slightly over time, but I just want to wish everybody a safe rest of the day. Thank you for joining us, and we look forward to seeing you again on the next webinar. So take care, everybody.
Thank you.